I'm Dr. Shirin Dason. I'm one of the reproductive endocrinology and infertility specialists here at TRIO Fertility. And just to give you an update on this event, the goal is to just ask questions, and I'm happy to provide you some answers based on my knowledge base. And it is going to be recorded, so the content will also be available to you after, or to anyone else you know that might want to watch it. So just be mindful it's recorded. You can put any of the questions that you have into that Q&A box, and then I'll just start to go through them and answer them as best I can. Perfect. So I think someone just asked, what is the fertile window? So in general, this refers to the time during menstruation when the sperm is most likely to meet the egg. So this varies a little bit for people. So people's menstrual cycles that are regular can range from 21 up until 35 days. And we know that the fertile window typically happens 2 weeks back from your period. So you don't actually know in the cycle that it is, but if you're having regular cycles, then you're able to predict within that cycle when it'll fall. So someone with 28-day cycles, they will ovulate around day 14. Someone with 32-day cycles is going to ovulate around day 16. Someone with 34-day cycles is going to ovulate around day 18. So that specific day changes, which means the fertile window, which tends to span about 6 days until the day after ovulation, can vary for people, right? So for someone with a 28-day cycle, it's going to be day 10 to 15. For someone with a 36-day cycle, then it's going to be a different time period. That's according to their ovulation day. And you can track it very specifically. You'll be tracking your ovulation day and you're tracking the day 1 of your period. So if you just started to log the first day of your period in your calendar app for a little while, then you would generally be able to count what your cycle length is, because we go from the first day of full flow of the menstrual period. So we do include the days of bleeding of your period right up until the first day of your next menstrual period. And that will give you an idea of when your menstrual cycle is, and you can count backwards to find out your fertile window. Okay, the next question is egg freezing and how it works and when it's a good idea. So egg freezing is a process where we stimulate the general resting pool of follicles within your ovaries. So everyone has a resting pool of follicles before menopause, and your body pulls one egg from that every month and ovulates it, and the rest of that group actually die off, and that's how we go through reproductive aging. So with egg freezing, what we can do is we can give you medication during a specific month to help stimulate all of the follicles to grow instead of just the one that is meant to ovulate. And those eggs we can take out of the body and put in the freezer so you can use it later. So that also answers the question of, does it deplete my fertility? No, because it's just freezing eggs that your body was going to have undergo programmed cell death anyway. And in general, the next part of that question, which is when it's a good idea, generally, your egg count is stable between your late 20s until about 32. So I would say to start thinking about it in your early 30s, because that's when you're going to have the best quality of eggs and the same quantity as in your late 20s. But generally, in terms of cost effectivity, when we're thinking about people who are actually going to come back and use those eggs, it's actually most cost effective around ages 35 to 37, because the concept there is that you're more likely to delay having children until after the age of 40. And so you're more likely to actually come back and use those eggs you stored versus if you're freezing eggs at 31. But this is a very personal decision. And so when you first come and meet with a reproductive endocrinologist, for example, at Evolve, which is our partner egg freezing clinic, then you'd have a thorough discussion of what your family plan is and specific guidance around whether it makes sense for you and when it might make sense. Okay. Do I need to stop caffeine or alcohol while trying to conceive? So we do know that both caffeine and alcohol do have effects on fertility. I would say caffeine more has an impact on early pregnancy loss and has been quantified when people are having more than about 500 or 600 milligrams of caffeine a day. So that would be about 5 large coffees or about 6 to 8 espresso shots. So it's quite a lot of coffee that's associated with pregnancy loss. But we generally suggest sticking between 200 to 300 milligrams of caffeine to be safe. So that would be it's still about 4 espresso shots or so, but it's about 1.5 to 2 cups of large coffee would equal that amount of caffeine. Alcohol is a bit of a tricky one. We do know that time to conception is longer in people who are chronically using alcohol in large quantities or binge drinking. It seems to have some effect, obviously, on early pregnancy. We know that there's fetal alcohol spectrum disorder and things like that that can actually happen in pregnancy. And so there is some concept that there's probably some impact on egg quality. It's just hard to quantify so exactly. We know alcohol is one of those things that does affect your health overall, and we always say fertility and egg quality are part of your health. So cutting back, staying within the recommended alcohol limits is always a good idea. Okay, so how long do I have to wait before starting another IVF cycle? There are different opinions on this. I would say that when we think about an IVF cycle, there are a few different phases of the cycle. So one of the phases is this concept of priming, which is where we get all the follicles to grow together in synchrony. And that takes about a month to do. And we can do it with a few different protocols. And then there's the stimulation phase, which is where you're actually taking injections and you're undergoing a retrieval. So when we use the term, when we say like, how long do you have to wait? It kind of depends if you need priming again, like if your doctor thought that the priming that you did or you didn't do would be useful to you or was useful for you in the past. And so that may mean that you're not actually doing a back-to-back stimulation. You're kind of doing priming, stimulation, but you could go right into that priming phase. Your doctor may also tell you that you need to work on egg quality if that was a specifically noted issue in the lab. And that takes about 2 or 3 months to work on. So that may also depend on how long you wait between a cycle. I would say for the majority of my patients, they can do back-to-back stimulations, like sometimes even 5 days apart, which is called a duostim protocol. So it is very personalized as to like what the advice is and how long you should wait. I would say there's no general criteria, like you must wait a month or something like that. It's really dependent on your body, on your stimulation protocol, on what was noticed in the lab as well. Okay, the next question here is what LGBTQ plus family building options are available at TRIO? So we have all of the options that are available to this community available through our clinic. So what that means is we can support people of any gender, and we have access to donor gametes. So we have access to anonymous donor sperm, anonymous donor egg. We work with different agencies or patients who have sought out agencies to work with for people who are offering to undergo stimulation for other people. So that would be like a fresh donation or a known donor who's undergoing a stimulation. And then we offer known donor as well. So we're willing to screen people for you. We can do all the necessary testing in-house, and we can facilitate gamete donation from someone that you actually know. So overall, we have basically any option that you can think of to build your family is available through TRIO, which is nice and can't be said about every clinic. Okay, risks or side effects associated with fertility treatment. That's a very broad question because there's a lot of different fertility treatments, and so hard to kind of go through every single one and talk about the side effects and risks. I would say that that kind of question would be answered like specifically to a specific treatment and medication, and your doctor would kind of have a thorough discussion with you about that. We do also have a lot of learning modules that have even more information than doctors often talk about and bring things up that patients didn't necessarily think of. And then we also have nurses that go through all of that. So most of our patients feel very well prepared for any sort of fertility treatment because we are very specific about discussing the risks and the side effects of every specific fertility treatment. Okay, next question here. What kind of things negatively impact sperm count and what should I avoid? So sperm count fluctuates. It's one of those things that really is sensitive to anything. So even a change in your diet, change in exercise patterns, change in your health in some way, either acutely, like you suddenly have a cold, you have a fever, or you develop some sort of chronic illness, and the sperm can respond to that. And it's also very sensitive to things like marijuana is a really big one that has an impact on sperm. Smoking is another one that has a really big impact on sperm. Alcohol has an impact on sperm, but again, in one of those ways that we don't quite understand, but we know that there's some impact on the quality of sperm, and more so an impact on libido and ability to ejaculate. So what I would say is that it's hard to avoid all of life, of course. And so there are kind of specific things that you can focus on if it's identified that you do have a sperm issue. And that would be things that are good for your health. So focusing on a balanced diet, avoiding processed foods, lots of fruits and vegetables, and avoiding things like smoking, definitely avoiding marijuana. That's been shown very specifically to impact the ability of the sperm to fertilize. Trying to cut back on alcohol use. These are all good goals for trying to improve sperm overall and improve quality of sperm. Okay. How long, again, typical treatment process really depends on the type of treatment you're describing. So I would say that I think we'd have to be a bit more specific with some of those questions because everything takes a little bit of a different timeline. And so your doctor will also discuss that with you very specifically, and it can vary. Like generally it's over like 1 or 2 menstrual cycles, but it really depends like what we're talking about here. Success rate of treatments like IUI or IVF for someone my age, very dependent on the actual age. So I'm not sure what age we're referring to, but I would say that IVF tends to have double the success of IUI at all ages. So it really depends, like if you start, say, between the ages of 30 to 35, chances of conception are going to be 20 to 30% per month with IUI, and they're going to be about 50 to 60% with IVF. 35 to 40 percentages change, so it's 15 to 20%, maybe closer to 30 or 40% with IVF. And after the age of 40, it's 5 to 10% in the body with IUI, for example, and IVF is like closer to maybe 15 to 20%. And by the time you get to 43, both those numbers become very low, like less than 5%, less than 10%. Okay, so very specific discussion around specific age, but those are general guidelines. If you're under 30, is egg freezing safe? Yes. Egg freezing in general is a fairly safe process. We do a very thorough intake history, so we really get to know all of your medical history, medications that you're taking, all that stuff. And we go through like a very specific risk-based analysis of whether egg freezing is specifically okay for you. So things that can sometimes change our decision-making about whether things are safe or specific gynecological issues, or if you have histories of migraines with OR, we may make modifications. If you have high blood pressure, if you have a history of a major medical condition that we need to send you another specialist for an opinion before doing egg freezing, there is kind of a safety assessment that's built into our initial consultation on our medical history before we specifically recommend it to you. When would you recommend starting with IVF instead of with other options? So if there's very poor, I would say like very clear guidelines to start with IVF is poor sperm. So sperm counts less than 5 million per milliliter and blocked tubes. And that would be found on a sonohystogram. So those would be 2 reasons that I would say IVF is maybe the only way to conceive. I never say never with the ability to conceive in the body because things can always surprise us. But I would say like those are kind of clear indications that we may need to take the sperm and the egg out of the body and perform fertilization in the lab. And otherwise, I would say for the most part, no one needs to start with IVF. I would usually start in the body, like trying to conceive at home on your own for 3 or 4 months. If everything else looks fine on paper, even with a low reserve or slightly abnormal sperm counts or something that's slightly abnormal on ultrasound. And then if that's not working, then we start to think about how to improve that and thinking about IVF as one of those options. Why am I being prescribed birth control when trying to get pregnant? We only use birth control in our fertility treatments very specifically to help time cycles. So for example, and for priming, which is one of the things I mentioned, like in regards to egg freezing or IVF, where we're trying to get all the follicles to grow together. Sometimes we'll also use it to, like for example, someone with PCOS who doesn't get periods, we might put them on the birth control for a short period of time so that we can time when their treatment is actually going to take place, because it may be very random when their body is creating ovulation. So we use it in that context, but really it shouldn't be used outside of that, because its purpose is to stop ovulation or stop periods. So those are kind of the couple of reasons that I can think of that we might be incorporating the birth control pill in treatment, to help with scheduling, to help for you and for the clinic, and to help prior to a procedure, and to help kind of prime in a stimulation. Lifestyle factors that can impact fertility. So we talked about this a little bit. I think that diet does play a role. We know that it plays a role in other areas of health. Very specifically for fertility, we want to be careful that females aren't over restricting as well, because some amount of carbohydrates is necessary for fertility and early brain development in a baby. And so sometimes people go on extreme diets where they're kind of cutting out carbs, but that would be less recommended around the time of trying to conceive. Like trying to have some minimum amount of healthy carbs in your diet, like trying to limit processed carbs is a good thing, like white carbs or candy, cake, things like that. But still incorporating healthy carbs is helpful. Exercise is helpful. And the standard recommendation is what I say to my patients, like 150 minutes per week, a mixture of strength and cardio, anything that motivates you to get your heart rate up, as well as strength training, which is helpful for like our bone health, especially for women. And then those things we talked about in terms of like cutting back on smoking as much as possible, limiting marijuana use, trying to limit alcohol use to like safe consumption. Those are things that I recommend for everyone. And then the last thing is thinking about sleep patterns. And I recognize that this is very difficult, especially for people who work shifts. I mean, I've certainly worked many shifts and worked overnight in my life. But as much as possible, like trying to focus on a regular sleep time, or maximizing sleep and good quality of sleep has been at least identified as a potential lifestyle risk factor in fertility as well. I'm interested in fertility treatment, but not sure how to start. So I would say the first thing to do is either reach out to our clinic, who can connect you with a patient care coordinator who could talk you through your concerns to understand how to connect you with the right person, or to your family doctor, who could also help guide you. I know that there are many people out there without a family doctor, but if you have one, that would be helpful resources. If you don't have one, then TRIO can certainly help to understand whether fertility treatment is right for you. We usually think about seeing a fertility doctor with very specific criteria, which is shared with family doctors throughout their medical training. So those would be things like if you're under 35, have been trying for a year, 35 to 40 have been trying for 6 months, and over 40 and have just started trying. Now, the difference in ages does not change the definition of infertility, but we do know that people who are over 35 and over 40 have a shortened timeline. So we're trying to expedite testing to understand if there's any barriers, but they may still be able to conceive even if anything is fine. So it's not to say that they're going to struggle, it's just to identify issues sooner. And then other people that should see us would be if you've struggled with 2 or 3 pregnancy losses that have happened in a row. That's called recurrent pregnancy loss. If you have irregular cycles, so you can't actually predict when you start to put them on a calendar when the first day of the bleeding is. I have a lot of people who think that like 5 days of variation is irregular. I would say 5 to 10 days of variation is actually normal. So it's more like you can't predict when the next period is coming, or like they're 40 days long instead of 35. Those would be kind of irregular cycles. And then people who are thinking about fertility preservation because they're planning to delay their family plans for whatever reason, finding a partner, advancing their career, not being sure about whether they want children, but not wanting the option taken away from them by age. So we're happy to see people for egg freezing, embryo freezing, sperm freezing, for all of those reasons as well. So that's the general criteria of who we see. And so reaching out to either a family doctor or primary care physician, or through TRIO to speak to a patient care coordinator, can help you understand whether it's important for you to see someone. What is the success rate for IVF based on different age groups? So I think I gave general success rates, 50% below the age of 35, 30 to 40% as you age from 35 to 40. So it goes from 40% down to 30, down to 20. Over 40, it's generally about 20%. And At 42, 43, we're talking about maybe 5 to 10%, and after 43, less than 5% chance. And that's just because a lot of people think IVF can kind of is there as an end-line treatment and can save everything, but it's not necessarily true. Like, it is still dependent on egg and sperm quality and quantity, and that is dependent on age. So we do see decreasing success rates. Can irregular cycles result in natural conception? Yes, they can. So in the studies in people with PCOS, which is one of the primary reasons for irregular cycles, they still achieved conception in the body, but it took them longer. So in the general population, we see 80% conceive within 1 year, or 85% conceive in a year with regular cycles. And in people who have PCOS, we actually see that it takes 2 years to reach that same number. And that's because cycles in people with PCOS, it can just be random ovulation. So if you're having regular intercourse, then the sperm can catch the egg. Or people just have really like irregular cycles, like they're 60 to 90 days. And again, regular intercourse will catch the egg. So we do still see natural conception in many people who have irregularities in their cycle. How long should we try naturally before seeking help? So, I mean, the general guideline under 35 is a year, between 35 and 40 is 6 months, and over 40 is right away. But overall, I would say it's reasonable to give everybody about 6 months in the body to really try to see if the egg will meet the sperm. And that's because we know that 75% of couples who are going to conceive that way will do so within the first 6 months. So you only gain an extra kind of 10% by waiting for a year. If you're younger, it makes sense to wait that year. And even in people who I see who are starting fertility testing, many of them actually conceive before I even see them again. But that's my general guideline, is I say, try for at least 6 months before seeking intervention. And part of that is because of the way that our interventions are, or our testing is, because our interventions are kind of crude in some ways. Like with IUI, it's about increasing egg number in the body and getting washed sperm placed into the uterus rather than just trying with one egg and sperm in the body in natural conception. And then IVF, we're kind of taking the eggs and sperm out of the body and trying fertilization in the lab and then putting an embryo back inside. So they're not like specific directed treatments. It's more about how can we increase the probability of conception now that it hasn't happened in the body. So often when I see people who have not started trying, I say that nothing that I can do in fertility medicine is going to speed up your time to conception. And it makes sense to try for 6 months before seeking out treatment. Do you recommend acupuncture, supplements, or other alternative therapies to support fertility? So I would say yes and no. The reason I say yes and no is because there is some evidence to support some of this. So there is evidence to support acupuncture, like very specifically around menstrual cycles, around embryo transfers. There is evidence for some supplements. So certainly if you're female and starting to conceive, you should be on folic acid, and that's because it decreases the chance of neural tube defects and other congenital anomalies. And those could lead to a pregnancy loss, so it likely leads to an improved pregnancy rate as well. Vitamin D has been shown to help with early brain development and is associated with the pathology of many gynecological disorders like endometriosis, PCOS, adenomyosis. A lot of people are found to have low vitamin D. Omega-3 also associated with brain function and improving brain function. And coenzyme Q10 is associated with egg quality, especially helpful in people over the age of 37. Inositol associated with improved cycle regularity in people with PCOS, works through the insulin resistance pathway. So there are very specific supplements that have been shown to be helpful. But what I would say is that a lot of these things can get expensive. Like some supplement regimens can be very expensive to maintain, contain a lot of pills. I've had a lot of people get very overwhelmed by the number of things that they're suggested to take or not take. And so in those cases, I say it's really not necessary to overburden yourself with all of these extra things outside of just focusing on a healthy diet, exercise, and sleep, because those are going to be helpful for your health, like very immediately and overall. Whereas the supplements, it's like varying evidence, and Some of them are really not directed, other than the ones that I told you about, which do show evidence. So spending a lot of time and money on them may not make sense for you at this time. Other alternative therapies, I mean, there are all sorts of things that I hear about, and sometimes it's brand new to me. And sometimes I'm a little suspicious when it's really brand new, because there are lots of fad things that come and go, right? Like snake oil is the classic example. We can talk about anything and say that it's going to be beneficial and not necessarily have a lot of basis to back it up. And so in a person who's Western medical trained, I'm really careful about recommending those things, because I don't want to recommend something that I'm not fully behind. But I don't necessarily, I think some of the things there's no harm in specifically trying, and I think it's reasonable to run it by your doctor and see if it's okay, or what they specifically think about it, so they could do a little bit of research and tell you, and also not to get too overwhelmed with all the different recommendations that are really out there, because a lot of them are kind of unproven at this stage. Okay, so I think I answered a lot of questions there, and now there are no open questions. Is there anything else that anyone else would like answered tonight? Might give you a couple of minutes, but we may just kind of end the seminar or the webinar a little bit early if we've run out of things to ask, which is totally fine. No problem. Okay, perfect. Well, maybe we will kind of end it off there. Thank you so much to those of you who came out tonight and wanted to ask me questions. I hope that I've answered them. And if you ever need any help with anything that's sort of fertility related, we welcome you to kind of reach out to TRIO. There are lots of resources available on our website, lots of resources even without seeing a physician, even just with talking with a patient care coordinator. And our goal, I think, as a clinic is really just to empower people and educate as much as we can, even if it's not directly through seeing people. So we hope that you find some of these resources helpful.